This week, the site of the former Pulse nightclub is cleared to make way for a permanent memorial, nearly 10 years after the shooting that claimed 49 lives. Plus, the nationwide measles outbreak and how it's impacting Florida, and a look at the state's physician shortage. This is Talking Central Florida. Hello, I'm Steve Mort, and welcome to the show where we take a closer look at the news in your region and community. Nearly 10 years after the Pulse nightclub shooting, the site is undergoing a major transformation. This month, the iconic sign has come down, the building demolished. It's all part of a long-awaited plan to build a permanent memorial honouring the 49 victims and the survivors. But as this next chapter begins, questions remain about the design and the timeline. Well, joining me in the studio this week to discuss this and other news, Joe Mario Pedersen from Central Florida Public Media. Good to see you, Joe Mario.
Happy to be here.
And for the first time on this program, Donovan Myrie from WKMG News 6. Good to see you, Donovan.
Thank you for having me, sir.
Thanks so much for coming in. Really appreciate it. Now we've seen the Pulse building demolished, Joe Mario. The site is cleared as well. I think it's pretty much cleared by this point, all within a matter of days. You went to the site to see that work taking place a couple of times. What did those who were gathered there tell you about the significance of this moment?
I think what I kept hearing was that there was a mixed feeling about seeing it come down. The image of it, of the club, for so many, there is that history, of course, of the joy that the club once brought, right? But it was, years later, obviously in the last 10 years, it was also a site of pain. It was a reminder of that pain.
Of course.
So I think to see it come down, from what I was hearing from folks, was it was tough to see that happen, but it was also a sign of progress finally, right?
Yeah. I mean, early this month, the city of Orlando gave an update on the permanent memorial plans. News 6, I guess, has covered this every step of the way. What are the key design elements now, and how are they intended to honor the victims and survivors? I guess everyone is now waiting for something to appear on that site.
Yeah, it's interesting because, as Joe Mario said, it was time. It felt like it was time for the building to go away and a memorial to at least start to memorialize what happened. It's hard to just look at that building and go, oh yeah, 49 people were killed there. I'm going to go next door to Wendy's or Dunkin' Donuts or something like that. Yeah. It really did need to be something special. What we saw recently is the design unveiled, but we only saw a little bit of it. We saw 6 images. They said it's about 30%. Right. Yeah. It's only about 30%. So we have another 60% coming in May, and I guess the last 10% coming after that. From what I could see, it's, I won't say atypical memorial things, but things you would expect at a memorial. You'll see a reflecting pool, places for, that you can sit, sunshine, there's openness. One aspect I did see on one of the pictures, it looked like names were there because there were flags next to the names.
Yeah.
I was trying to blow up the pictures to really get a good look at it.
And we're showing some of these images on the screen for our YouTube viewers.
Yeah. So it looks really interesting. One question I have is, where's the parking going to go? Because that is not the easiest area to get around down there.
Place to park now.
Yeah, this is true. But the images do look very pretty. We've seen this happen before in places like Oklahoma City. Now, mind you, that building was destroyed, so you had to knock it down. Shanksville, Pennsylvania, they've done a memorial. Yep. There's been a memorial outside of the Pentagon Flight 77. So we've seen America. I hate to say it, but we know what to do here. We know that after tragedy, memorials need to happen.
Yeah. And of course, the committee that's been charged with putting this design together and taking in public input took input from a lot of those places that have already got memorials in place. Before the demolition began, Joe Mario, the city had already started removing and preserving artifacts, right, from inside the club. I mean, what was saved, and how do we know how those items are going to be incorporated into the memorial or used in future exhibits?
Most of them, we don't know the very specific details of how that is planned to be. Yeah. But I mean, as far as those artifacts are considered, the sign, of course, which recently came down. They've talked about preserving chandeliers. There was a bar top that was preserved, several posters inside. One that we specifically do know how it's going to be used. You mentioned the reflection pond that will be part of the memorial. We know that the dance floor inside the club will be part of that pond. It'll make up the I guess the bedrock, as it were, of the reflection pond.
Yeah. I mean, both your newsrooms, I guess, have been hearing from survivors. You talked about it just off the top, victims' families and so on, the broader community about this demolition. There's been a lot of tension, hasn't there, over the years, Donovan, about the design, what should be there at the site of the Pulse nightclub. This has been a source of tension and controversy over the years.
It's been hard because it's taken so long. It has taken such
Nearly
a long
10
time.
years, yeah.
Nearly 10 years. I remember that day. I was working in New Orleans, but I happened to be in town that weekend. My wife works here, and we were spending a weekend together, and next thing you know, I'm here for extra days because I'm now covering the story. 10 years. 10 years is a long, long time. And again, a long time for that building to be there. So, how do you say you can't please everybody?
Yeah.
And that's, I think, the tough part, because obviously there are problems with getting the building, with getting the property, with designing what the memorial will
Whole
look like.
controversy with One Pulse.
With One Pulse, yeah. And then one day it's like, wait, One Pulse is gone? I mean, just like that. And we're starting all over again. I think Mayor Deming said it the best a few months ago, where he said, it's time to do this. It's time to put a memorial up.
Yeah. I mean, what's the timeline from here? I guess everybody wants to know at this point. Here we are. This is where we are at this point. When does construction begin? Do we know how long it's going to take? What should the public expect over the next year or two?
Well, construction begins, we have a hard date for that. That's September 26th of this year is when that actually will start. As Donovan had mentioned, we only have 30% of the design, and we're getting essentially the 60% design in May. Right. But apparently, the target date for the completion of the project is supposed to be fall of 2027.
Interesting. Well, we'll certainly keep an eye on it. We'll put up links to the reporting on Pulse from Central Florida Public Media and WKMG News 6 in the podcast feed show notes. We'll also put up a link to the most up-to-date design renderings, the 30% renderings as they are at the moment. Meanwhile, be sure to like and subscribe to Talking Central Florida. You can listen anytime on Apple Podcasts, Spotify, and watch on YouTube at Talking Central Florida. Next, we wanted to talk about some healthcare issues. Both Joe Mario and Donovan have been covering healthcare stories that affect Central Florida, so let's dig into some of them. And we'll start with measles. There is an outbreak of the highly contagious viral infection in the state right now. Florida ranks 4th in the nation for measles cases, behind South Carolina, Utah, and Texas. So let's get into this. Joe Mario, what do we know about this outbreak in Florida? Where did it begin, and how significant is it?
Pretty significant. As far as where we're seeing the largest concentration of numbers, that's out of Collier County. Specifically, Ave Maria University, it's a private Catholic college. I think in February, we saw an outbreak of about 40 over there. And currently, I say currently, but our latest numbers are up to March 14th at this point. It's 104 out of Collier County. Florida has 140 cases diagnosed right now. That vast majority is coming out of there.
That's pretty striking for a disease that is supposed to be eradicated.
That's huge. In the Florida Department of Health's public available database, which goes back to 1992, there isn't a single year that comes close to that. I believe 1992 actually was the strongest year. And I believe that was about 42 cases. So we have more than triple that right now.
I mean, both your outlets have been reporting on this locally as well. Where do things stand in Central Florida at this point, do we know?
Well, Central Florida has been mostly spared. I haven't seen the latest numbers, but the numbers that I saw, the last one was, we saw 2 cases in Seminole, and that was back in 2023. We have 1 case in Osceola now. We've had 1 in Orange and 1 in Polk back in 2024. We pretty much thought we beat this as an infection, as an outbreak.
Yeah.
And it's back. It's scary.
Yeah.
Is that a correct assessment? Has Central Florida largely been spared at this point?
Yeah, no, that is. I mean, as far as the numbers go, Osceola County, like you said, is so far the only Central Florida county that has shown that. I believe that case was acquired outside of Florida, but due to the contagiousness of measles, that is, as you said, I think that's quite scary.
Yeah.
And it's then you look down at Tampa Bay. I saw the last numbers I saw were 6 in Pinellas County, 2 in Hillsborough and 1 in Pasco.
Right.
But for some, basically for Central Florida itself, 1 in Osceola, and it came from someplace else.
Right.
So far, so good. But we don't know how long it's going to hold for.
Yeah, and scientists do talk a lot about where these cases are acquired, whether they're locally acquired or have been imported into the state. Why is that an important metric?
So that's hugely important because as far as, where these, as you point out, a lot of these cases come from outside of the country. I think it would be fair to say that, before this year, measles was not an endemic disease in Florida, right? Yeah. But when you have somebody from another country where perhaps measles has not been eradicated, right? And they come here to Florida, which has a growing body of unvaccinated people, well, then you are introducing a new equation for the disease to start thriving in Florida.
Yeah, I want to talk about the vaccine issue in a sec. But
Sure.
I mean, just before we do that, what is the situation nationally? Places like South Carolina, Texas, as we mentioned, Utah.
So it is significant. So South Carolina definitely leads the nation right now as far as cases goes. Over 668 right now. Utah 275, Texas 147, Florida right behind Texas. And as far as where we are in that trajectory, I think this is a really good way to look at it is last year versus right now. So the total amount of cases of last year was 2,285. Right now, so far in 2026, we have 1,487. So we have more than half of the total cases in the first 3 months of this year versus last year, right? So that's one of the reasons why epidemiologists, why scientists are so concerned about this, as it is an extremely contagious disease.
And certainly a lot of traffic, particularly between Texas and South Carolina and Florida.
Yeah.
Well, as we discussed on the show last week, the DeSantis administration's efforts to shake up the state's vaccine policies for school children failed in the most recent legislative session. House leadership refused to take up a bill that would have allowed exemptions from immunization requirements for kids based on a parent's religious beliefs or conscience. The governor has, though, reiterated his determination to get the measure over the finishing line before the end of his term. A lot has been written about links between vaccine uptake and measles outbreaks. Do doctors and medical experts think that link is strong? I'll ask you about that, Joe Mario, because you mentioned it just now.
Yeah, pretty much every expert that I have talked to has said, yeah, that is pretty much it. That is the link that we are seeing, right? The bigger that unvaccinated population is, the greater the chance that you're going to see measles spread in that area. And Florida has had an increasingly larger population of unvaccinated individuals. In Orange County, now for the record, this is based on 2023 data. In Orange County, 9 of the largest elementary schools in Orange County had populations of vaccinated children that were below the 95% threshold that the CDC recommends population have in order to find that herd immunity that we want against measles. I would say from what we've heard from experts, the link is very, very strong.
A lot of people familiar with that herd immunity term, of course, from the COVID pandemic.
Because when was the last time we really said that?
Right.
It was years. It's been years.
Yeah. Do we know broadly how the state has been responding to the measles outbreak in Florida, Donovan?
Well, it's interesting because, Joe Mario was talking about the numbers for this year. What are we at? Over 140. Yeah. Last year, I believe we were at 7 for the entire year.
Yeah.
And it was 12, I think, the year before that. So it really, it's been a dramatic jump. One of my colleagues, Christy Zizzo, she did an infographic on this, and you literally see everything looks okay, and you get between 2025 and 2026, and there's this almost vertical line that's going up. As for the state, well, let's say we don't have the best state when it comes to keeping us informed about health problems. We saw this in COVID. I took this very personally during COVID because I have a doctorate. I do data. To tell a story later on. The state cut the data off years and years ago. It's happening again. They're not acknowledging this. I think recent numbers are 2024 on the state websites. There's no map of where outbreaks are. There's no public service announcements to say, hey, this is a problem that we're having. It's almost as if the state is turning a blind eye to this, and they just think, oh, it'll go away, like everything goes away, like COVID went away.
Well, we'll put a link up to Christy Zizzo's infographic in the podcast feed show notes. But let's discuss some other health-related stories while I have you guys here. Donovan's been reporting on some of the models that have been emerging, some more successfully than others, I think it's fair to say, to tackle enduring issues in the healthcare industry, the complexities of insurance and rising premiums, and crucially, a shortage of doctors and long wait times. I think a lot of people are familiar with this one. Just first off, Donovan, give us a lay of the land. News 6 has examined the issue of a shortage of physicians in Florida. What do those projections look like?
It's interesting. Throughout the entire nations, well, here in Florida, the Florida Medical Association is anticipating a shortage of 17,000 doctors in the state by 2035. So that's in the next 9-10 years.
Less than a decade, yeah.
I've seen it as high as 137,000 for the nation. And there's a bunch of factors going into this. When we all grew up, what did our parents want us to be? Doctors and lawyers. It's not the same today. Becoming a doctor, you have a burden of your education. You have a burden of insurance that you have to carry. And a lot of doctors complain dealing with insurance companies is really tough, and they spend a lot of time not doing the medicine-y things, but doing the billing things.
Yes.
So things are, the doctors coming in is not keeping up with the doctors going out, whether they're leaving on their own or whether they're retiring.
Yeah, I want to dig into the whole insurance issue in a moment. I mean, rural areas and minority groups seem to be experiencing this shortage more acutely, not just in doctors, but also in nurses as well, medical staff, I guess.
Yeah, we are seeing this across healthcare, right? But as far as nursing goes, according to, I believe it was a study in 2019, Florida had a shortage of 11,500 LPNs, right? Licensed practical nurses. And that is a shortage that they being the Florida Hospital Association, are expecting to only get bigger and worse, right? A shortage of 60,000 nursing positions across the entire nursing industry in Florida by 2035. And, they associate that to an increasing population by that time. I think a 21% increase in the overall Florida population at that time.
Yeah, worth noting that, again, this is another issue that has a lot to do with our growth as a state. Mm-hmm. Well, let's look at some of these models then that have sprung up, Donovan, that you've been reporting on. One of them seeks to provide quicker access to doctors for, I guess, those that can pay. Mm-hmm. Tell us a little bit about these so-called fast pass doctors or practices and what problems they attempt to solve.
Think about this. In the United States, I'm going to keep it very broad.
Yeah.
Think of three broad models. We have our traditional care models, which is probably what everybody in this room is on. You have insurance, you go to your doctor. If you want to get in quicker, sometimes you'll have to go at 7 a.m. so they can squeeze you in or something like that. And you rely on insurance, and there's billing questions, and nothing ever seems to be right, and so on and so forth. Two models are emerging. The first one is concierge medicine. Mm-hmm. And just like a concierge at a hotel, it's like you go to the front of the line. You are special. Of course, you have to pay for this. With concierge medicine, you're looking at, it's almost like a gym membership. Annual fee anywhere from $2,000 to $10,000 to even $40,000 a year. Okay. We ran a poll that said, would you pay money to keep seeing your current doctor? And it was about 50-something to 40-something. It was close, because some
50% would.
About 53% wouldn't.
Would
and
not.
About 40-some-odd% said they would. It's hard to say, hey, on everything else you're spending on a doctor, I need you to spend more money just to, see this doctor. With that concierge medicine, however, comes this idea of you can see the doctor. You can probably get same-day medical appointments, okay? Imagine you're going for a checkup. Well, your checkup is now a blood draw. The doctor comes in, spends 20 minutes with you, says everything is great, anything hurts, see you later. Concierge medicine, you may spend an entire day at a facility. You might go through a battery of tests. You might just, instead of those 3 blood tests, it might be 10 or 11 different blood tests and things. So it really is, putting the patient first. How does that happen with that patient going first? You are basically paying to get there. The third model is something called direct primary care. And it's kind of a mix because concierge medicine still uses insurance. Direct primary care, you're still paying for that doctor. But in paying that doctor, you pay that doctor directly. They don't take insurance. But remember this, with direct primary care, you're only dealing with the physician. You break a leg, you're on your own. Okay, you're off to the hospital.
So you would still need to have insurance if you wanted to get any extra care.
Exactly. So it's a bit of a different model. The doctors actually like direct primary care because they don't deal with insurance companies at all.
Well, how much of this is about insurance? And is it because insurance is not reimbursing them enough, not reimbursing them, in time?
I think what you'll find in this, and I have a story that's coming out tomorrow.
Today being Tuesday.
Today being Tuesday, the story comes out tomorrow, and it's about medical tourism. And in doing more of that research, one of the quotes I came across was a doctor who said, everybody upcharges because everybody needs their slice of the pie. So, let's say you have an ailment, and let's say that ailment really costs $5,000 to treat. Well, by the time you go through a hospital and the X-ray and all these different people, it's now a $10,000 or $12,000 something to treat because everybody needs to get their little part of it. People will charge more to make sure they recover what they need to recover. And that's what's kind of killing us and things. And it's killing not killing, but it's hurting the doctors because they spend so much time in paperwork, in doing things, in defending the things that they do. There's a story that went viral, I think, last year, the year before, about a woman who was literally pulled out of surgery because the insurance company called with an emergency and it was a billing question. And she goes, I'm in the middle of something.
Astonishing.
Can't this wait,
Yeah. Well, I'll put some links up to your reporting, including the new one on medical tourism comes out on Wednesday in the podcast feed show notes. Talking of insurance, Joe Mario, I mean, Floridians, it turns out, bought the most plans on the Affordable Care Act exchange of anyone in the country, right, most recently, despite those recent premiums spikes that you and I have talked about. A lot of numbers, the numbers did decline, though, overall, I think, the end of those federal tax credits. Did a lot of people lose coverage in Florida?
We have to be careful about the terminology. It's hard to say. There are a lot of people who no longer purchase plans from the ACA marketplace, right?
Okay.
As far as coverage goes, perhaps they went somewhere else. We don't know. We will get a better idea of that throughout the year. It is probably safe to assume that, a lot of people did lose coverage. And worse is we're probably going to start to see more people lose coverage. At least that's what I'm hearing from experts. We had, I think, 202,000 less people purchase plans in Florida this year versus last year, right? 4.7 million people last year, 4.5 people for this enrollment period. And the reason why that's significant is, like you said, Florida is it is the number one place for purchases of the ACA marketplace insurance. But that 202,000, like I said, experts are expecting to see that go up. It is unclear how many people in the 4.5 million were aware that their premiums were going to go up. How many people just kind of set it and forget it as far as that enrollment goes and just went right into the next year just to see a huge premium increase, right? Experts were saying that nationally we were expecting an increase of 114% in premiums. Some cases even higher here in Florida, right?
Yeah, and maybe with some of those eye-watering premiums, concierge services might, for those who have resources, might seem more attractive. I mean, it's not just the smaller practices, right, that have struggled with the insurance reimbursement model, leading in part, I guess, to this concierge model. Major retailers as well, and you've reported on this, Donovan. Companies like Walmart and Walgreens have also made big bets on healthcare, couldn't make it work.
Big bets, and they lost.
Yeah.
I mean, big bets, and they lost. Walmart had 51 of these so-called clinics within their stores or clinics adjacent to their stores, and they shut down their 51 clinics. They were hoping to have hundreds of them within the next few years. Walgreens is even worse. they took a $6 billion loss on their ideas. Walgreens was Village MD. Walmart had their own Walmart clinic, Walmart Health, I think it was called. Their idea was we are within 10 miles. 90% of America was within 10 miles of a Walmart or a Walmart supercenter.
Yep.
Come to us for your healthcare needs. The problem was they're trying to duplicate that small doctor's office, and people weren't really going for it.
They didn't feel like there was the personalized care or something like that.
Yeah, and and then there's this idea of, well, we've seen it work with other things, but if you think about the places where it's worked in niche stuff. Okay, optometry. You've seen your Target optical, your Walmart optical, your Costco optical. You've seen it with pharmacies, at Publix pharmacies. The latest, which actually spurred that story, was both Costco and Amazon getting into fertility.
Yeah.
And just a very, very small part of a very bigger market, but they're concentrating just on that one area. So basically, it's this idea of, I think a lot of big retailers have learned their lessons. Don't try to go all in. Don't, at one point, we were talking about like the x-ray machine over on aisle 4. Yeah. You don't want that, okay? Yeah. You still want that personalized care. You still want things that are going to be constant. The biggest success story that we've seen is Minute Clinic by CVS. But if you've ever been into a Minute Clinic, it is not even as big as this podcast room. It's very small, okay? And
that's like where you get your vaccines. And
exactly,
things like that.
Vaccinations. Again, it's steady. It's not a heavy lift. It does generate some revenue, and you're not trying to basically, recreate everything. And, with that, there's people, there's machinery, there's licensing and so on and so forth. Keep it simple. Keep it very, very simple.
Really interesting reporting. Before I let you guys go, I did want to drill down on another health story that we mentioned briefly last week. The legislature this session passed a bill to temporarily block a Florida Department of Health emergency rule that would have prevented access to HIV medication for many people. It's a temporary block, though, through June 30th. Why was access to HIV medication at risk for some in the first place, Donovan?
It comes down to federal money. We've had... I think it's about $900 million, and it's been stagnant for years. Yeah, I mean, it just hasn't gone up. I think it's since 2012. $900 million distributed among the states, and you've got higher drug prices. You've got more people needing this assistance, and basically Florida said, we're going to come up short, and we're going to come up so short that we really have to lower the threshold of who can apply for this. And I can go into all these numbers, but here's what it comes down to. If you're making about $63,000 or $64,000, you qualified. They've knocked that threshold all the way down to $20,000.
Wow.
Yeah.
So there's a lot of people.
It's a lot of people. On top of that, they've taken the Biktarvy, which is the once-a-day pill for HIV. They've gotten rid of that. They're like, no more. So they're trying to make up a deficit of $120 million. And they're not the only ones.
That's significant. What does HB 697, that's the bill number in question here. What does HB 697 do? I mean, this is a temporary stopgap, right?
Yeah, I mean, it's exactly that, right? It's a stopgap. It would stop that emergency rule that Donovan was just talking about, issued by the Florida Department of Health earlier this month. But temporary is the key word there, right? June 30th is what that bill would be effective for, from whenever the governor signs it, which that bill is on the governor's desk, until June 30th. After that, the emergency rule is back in place.
Yeah, and we're recording the show on Tuesday morning, so things can change.
Could change.
The governor's signature, for example. Department of Health is getting sued over this emergency rule by the AIDS Healthcare Foundation, but Florida isn't the only state, as you alluded just now, Donovan, to where people living with HIV could lose coverage. How does the federal funding issue seem to be impacting the rest of the country?
Yeah, and it's interesting because, again, it's not just Florida. 18 states are pulling back on this funding. Yeah. And when you look at the map, it's not, it's all red states or something. It's a variety of different states because they just can't keep up with this. This is a health crisis. It's a health crisis that I think has flown very much under the radar. And I think it's, the one time you can honestly say the burden is put on the states and the federal government hasn't kept up with trying to basically keeping up with inflation, keeping up with growing patient demand. It's just they're coming up short. And again, in Florida's case, they don't want the whole system to collapse. You actually have to look at Florida and go, I kind of feel what you're saying here. They don't want the whole system to collapse, but they're like, if we don't pull back, we're going to have nothing.
Well, just to wrap up, you wrote a piece recently, Joe Mario, about the challenges of covering all of these healthcare issues that we've talked about here today, particularly when it comes to getting public records from the Florida Department of Health. What's your experience been there? What's the problem?
So Donovan mentioned this earlier in the show. It's just that the Sunshine State has really changed its stance in how it administers public health information and not being very transparent about a lot of things. We were talking about measles earlier, and despite that Florida has some pretty historic numbers right now as far as measles cases go, trying to get someone from the Department of Health to talk about this is a lot like pulling teeth. That Osceola County number that we were talking about, yes, it's only one, but it's a very contagious disease, and that's concerning. And trying to get Osceola County to talk about it, I think I asked the same question 3 times, which was just the hard-hitting question of what advice do you have for residents at this point? Sure. And like I said, 3 attempts, and we finally got something, and that was really, check the website, right? Which really isn't all that helpful. But this kind of speaks to, I guess, the way things have changed with how public health is being represented here in the state for the last few years. Trying to get records requests honored has been extremely tough. You're either told that, the records that you're looking for are non-responsive, which sometimes that's a little frustrating because you can't tell if truly that record is not there or if there's some kind of miscommunication, right? And trying to communicate that with the state.
Non-responsive, meaning that it's just not available.
Exactly. But that in and of itself, right? That phrase, we're not sure all the time what that means. And trying to get some clarity on that is very difficult. Other times we're met with different kind of stymies, such as like monetary issues, right? So like it's not uncommon for a records request to come back with some kind of clerk price, right? It's going to cost some money to get the report that you're looking for, and that is fair, right? Most of the requests that I've seen are somewhere in the ballpark between like $100 to $200. Mm-hmm. I've seen it get much, much higher. I'm sure you have too.
We just got a bill from, I won't say which law enforcement agency, but it was over $10,000. And it was something that was put in by one of our investigative reporters. And he literally said, I have to now pare this down because I'm not spending 10 grand. Mm-hmm. And the news director's not giving him 10 grand to spend on this record. On this records request.
Nor should information that's available to the public cost that much, right? And Donovan, I'm not trying to like win any races here. And don't get me wrong, $10,000 is astronomical in most cases, right? I can beat that, unfortunately.
No.
I got a records request that was, now I want to be clear on what this records request was. I made a records request, and I'm sure that you've made a similar request to this also. I just asked for a records request of the number of different records requests that were made in a single month, right? And that was going to cost apparently over $3 million. Now, I communicated with the state asking them, hey, are you sure? And if that really is the cost, what can we do to maybe, whittle that down?
Right.
At which point they became non-responsive.
And that's what we do when you get this giant bill, then you're like, okay, can we make it words that begin with the letter J, just to kind of get it down, because basically you're paying for their labor, the time that clerk is going to take to go through stuff and get it down and put it onto a PDF or a USB or a drive or a disk or something and get it to you. So $3 million.
I challenge any reporter who is listening to this to present a records request that was more costly. So far, I have not seen it happen.
And you haven't.
Nor should I.
You haven't found the $3 million yet.
No, not yet. But if anyone wants to, shell out, please.
Well, I'm sure both of your newsrooms will keep at it, and we'll put links to both of your reporting, Donovan and Joe Mario, in the podcast feed show notes. Joe Mario Pedersen, Central Florida Public Media. Donovan Myrie, WKMG News 6. Thank you both so much for coming in. Really appreciate it. appreciate it.
Always
Thank
a pleasure.
you.
Thanks for being here. Be sure to join us on social media, meanwhile, for more discussion on the reporting we're talking about here on the show. We're at Talking Central Florida on Instagram and Facebook.